Hi guys, welcome to my presentation. Myself Ajin Shah. Today the topic of my presentation is one of the largest joint in the body which bears all of our weight and provides stability to our lower body. Yes, it's right. It's a hip joint. In this video, we can see the hip joint biomechanically. The hip joint, are also known as the coxofemoral joint, is the articulation of acetabulum of the pelvis and the head of the femur. Type and variety. The hip joint is a synovial joint of ball and socket variety with 3 degrees of freedom. First, the flexion and extension in sagittal plane, adduction and abduction in frontal plane, and medial rotation and lateral rotation in transverse plane. Function. The primary function of hip joint is to support the weight of the head, arms, and the trunk. Shortly we can say as hat. Structure of hip joint. First, we can see the proximal articular surface. The cup-like concave socket of the hip joint is called the acetabulum, which is located on the lateral aspect of the pelvic bone, which acts as a proximal articular surface of hip joint. The pelvis is made up of 3 bones, the ilium, the ischium, and the pubis. The pubis forms the 1/5 of the acetabulum, and the ischium forms the 2/5 of the acetabulum, and the remaining forms the ilium. An acetabulum contains a unique portion known as lunate surface, which is covered with hyaline cartilage, which is the exactly articulating surface. Acetabulum. What is acetabulum? Acetabulum is a horseshoe-shaped or cup-shaped structure. Acetabular notch. It is a deep notch in the inferior aspect of the acetabulum, which is covered by a ligament known as transverse acetabular ligament. Acetabular fossa. It is a rough-on depression in the center of the acetabulum. It does not take part in articulation. The femoral head does not contact in the surface. Acetabulum is inferiorly tilted 50 degree and anteriorly tilted 20 degree. In this picture, we can clearly see the open lateral view of acetabulum. Acetabular labrum. Acetabular labrum is a wedge-shaped fibrocartilage ring. It is attached to the periphery of the acetabulum. It increases the concavity of the acetabulum such that it increases the stability. It provides negative intra-articular pressure. This labrum contains a lot of free nerve endings which helps in proprioception. In this picture, we can see the picture of acetabular labrum. Distal articular surface is formed by the head of the femur. When we see about femur, just inferior to the most medial part of the femoral head, there is a small rough-on pit called fovea or fovea capitatis, which is the site of attachment of ligamentum teres. The femoral head is attached to the femoral neck is attached to the shaft of the femur between the greater and lesser trochanter. The femoral head is oriented superiorly, medially, and anteriorly. This picture shows the posterior view of femur. Thank you all for listening to my presentation.